that's another question. Will the growth come back after surgery? Welcome, welcome, welcome. Alright guys, so welcome to another episode of Orain and Daniel. On today's episode, keep saying episode. Alright guys, so today we'll be talking about something that it's a burning question for many. And as you know, the channel is Orain and Daniel, and I am Orain. So I'll be the one to tell you the story today. So a quick story on how my face changed, and practically other features as well, but let's stick to the face, which many people would have recognized. So it would have started with kidney failure end stage. That's really the original diagnosis, but indirectly parathyroid issues would have been the main cause or the root cause. So what is parathyroid issues? That we have to really understand. So as a little child, I didn't look like this at all. The changes would have started around 3-4 years ago. Guys, the years are moving very fast, especially that we're in a new year. But it was at the end really of everything. It's where I had a tumor on my parathyroid gland, which causes it to produce way more than it should. What does it produce? It produces PTH, parathyroid hormone, and that really regulates the calcium levels in your body. So my body would have had way too much calcium, and the how it actually distributes the calcium would have been irregular. So it's storing calcium in places that it should not have been stored. And unfortunately, that was in my face, my right mandible, or my jawbone. As you know, the jawbone is your mandible. But let's not mix up what happened, because the popular misconception is that I had thyroid issues. Thyroid is actually in front, and that's where that really controls like your metabolic rate, and it really has nothing to do with calcium, even though they have similar names. The parathyroid is behind. It is actually 4 glands in total, and that regulates calcium levels and also provides the parathyroid hormone. So when mine got out of control, I would have got the information from what is called a sesame scan. It's really a more powerful x-ray of the neck to actually visualize the glands, the parathyroid hormones. Mine was enlarged and was producing too much. In the event it causes abnormal growths, these are bone fragments or lesions in places where it should not have been, again on my face. So many persons are again, the popular misconception was that it was a swelling that was on my face, but it wasn't a swelling, it was a growth. It was a bony lesion, which is a localization of parathyroid hormones or calcium. So in simple terms, it was a very tough, hard segment, and that's the reason why it could not have been popped. It wasn't a cyst, it wasn't inflammatory, it was hard to the touch. Also, other aspects of my skull would have changed. In diameter, it would have gotten enlarged. So all of those factors into the complete change or deformity of my skull. Remember guys, your skull shaped your face. So if again my skull changes, my whole face would have changed. So that's basically the backstory of what really happened. to fix the issue now, that was a whole different story, because that would have resulted in several surgery. I had to do pre-surgery, that mean pre to the correction, which was to actually remove the parathyroid um, glands. So I will be showing you guys pictorial images to really paint a better picture, a better understanding. I'll show you surgical pictures. I'll show you before and after pictures as well. I'll show you surgery scars. The first scar would have been under my neck, which was an incision. This incision, they would have went in and took out 3.5 of the 4 parathyroid glands, which was overproducing. But again, you do need calcium. You do need PTH hormone as well. So I would have gone on to artificial calcium in the form of Tums, which is calcium citrate, and calcium acetate plus calcitriol. Those are our medicine that would help in the production of calcium in the event that I don't have any producing normally or naturally. But it's overproducing, and there were medicine that can actually reduce the production, but it doesn't work, and it doesn't work as fast, because I was on Zemplar, which would have reduced the effects but was not doing it fast enough. So I had to go to the surgical step, because you have medicine, then you have surgery. So that was the first surgery which I did. That surgery was horrible, of course, based on the fact that not the surgical procedure, the doctors that you were, they're amazing. It does cost a lot, but the surgical aspect was flawless. Even the scar is minimal. But I went into hypocalcemia. You have to understand what is hypercalcemia and what is hypo. So hyper would have been high amount of calcium. Hypo is low, similar to hypertension or any of those stuff. But I went into severe hypocalcemia, meaning I had little calcium in my blood. The results of that, or the symptoms of that, was bones, muscle spasm, twitching, muscle pain. It was completely horrible. I spent like 3 months on the ward at UE trying to get my calcium back up, healed from the surgery. Plus that was 2 surgeries in one, because I had to remove a part of the tumor that had gotten so big on my face to send abroad for testing, which was a mandible biopsy or a jawbone testing to see if it was cancerous or it was just a benign tumor. Thankfully, it was a benign tumor, and the diagnosis was Brown's tumor. Well, not Brown's, but brown, based on the fact that the stuff that would have came out after surgery is like a brownish fluid. So the pathology testing really after the removal would have shown a brown fragment, hence the name. So the testing came back benign, thankfully again. The surgery healed successfully, and my calcium went back up, so I was off the ward, thankfully. And I was one step closer into reconstructing my face, based on the fact that I had stopped the growth, because that's another question: will the growth come back after surgery? To answer that, we'll have to know why the growth was there. Again, it was because of hyperparathyroidism, which I would have corrected with doing the surgery, and we would have tested it to see that it's not cancerous, and it's not a problematic really if the growth has stopped, because really it's not painful, it's just a hard fragment. However, issues with the growth was it was hard to eat. It was changing the way I talk based on my voice of the tumor pushing against the normal structure of my jawbone and my teeth lining. So that correction would have been very important, of course. Also, because of the overbite caused by the changes in the jawbone, I was biting into the tumor, causing bleeding issues. Again, hard to eat, hard to talk. So those corrections needed to be made, but it being a benign tumor was completely a good outcome or good information to have, because you wouldn't want anything else. So after fixing the parathyroid issues, I had to wait because I could not be operated on immediately based on other comorbidities, and also the the timing. I could not be doing two major surgeries in the space of 6 months to a year. I wasn't growing anymore, which made it easier to deal with. So I wasn't worrying with my face being completely deformed to the point where I couldn't eat or anything, because I've seen images and it's completely horrible. So a year had passed and it was time for the next surgery. Again, surgeries are extremely expensive, so I had to really gain funds for the surgical procedure, plus buying the stuff for surgery and all of that. So it was gaining funds plus getting the date for surgery. Again, I am not operating on myself. The doctors are very limited in Jamaica. I think there's only one facial mask specialist that could have really operated. Plus he has his other doctors. So it was a long process again. Like from the year started, really took a while for me to really get admitted. I even got admitted and was released. It was a runaround, but again, nothing happens before its time. So eventually I did get to do surgery. That surgical procedure was completely horrible. Like I keep saying they're horrible, but not horrible in the sense that the outcome wasn't good, but the whole idea of surgery and the pain plus the just the entire environment of being admitted and have to go into surgery. Because if you have never done major surgery before, I don't think you have the understanding of what it is or how it affects you mentally. Laying on that table, waiting on instructions as to, oh my god, this is completely horrible. But again, there is a cause, and the cause is let me take a breath. Anyways, so let's not go down that line of argument. So the surgery went well in my perspective the first time, because I came back from the ward. Thankfully, I waked, everything was normal. Again, I was in pain, of course, I was bleeding, but then I realized that I was bleeding way too much. Like the first day after surgery, this is not normal. I was spitting blood repeatedly. I was filling these containers or these kidney dishes with blood. So I called to the doctor. Mind you, my mouth was shut. I could not talk. I had to be typing on my phone to tell them what I'm saying. I'm saying, hey, I'm bleeding too much. I'm bleeding so much that I'm swallowing back blood. And it was an issue. It was an issue so much so that the doctors, they came and they tried to stop the bleeding by suctioning out the blood. They tried to stop the bleeding by filling my mouth with gauze. Mind you, my mouth was closed and my jawbones, they were literally nervously shut. They ripped it wide open trying to stop the bleeding, but the bleeding would not stop. I could feel the blood spraying inside my mouth. So they decided that, hey, you will have to do another surgery. And why I had to do another surgery? Because the bleeding got so much, it started to bleed back into where they took out the fragment of bone, or where they did the actual surgery. So now it seemed as if I had a whole new tumor to the opposite side of my face. Mind you, the tumor was on the right, and now I have the severe swelling on the left, way bigger than the one before. Also, it was diagnosed as a hematoma, which is blood collecting, where there has been an impression or a surgical scar or something like that. So it uh it collected so much and it got severely hard because again it's blood collecting, and blood with oxygen is gonna start to hemolyze and clot. So I had so much clotting. I had to go back to surgery. I went back the following day, and no doctor wanted to put me to sleep because, mind you, I was under general anesthesia like the day before. So now the second day, no anesthesiologist would approve of me going to sleep. Again, prior issues. I have heart issues where I had a full-blown heart disease and did an open heart surgery. Plus before that, I would have had kidney issues, not even issues, a full-blown kidney failure, and other illnesses, and also other surgeries. I am just coming from a full-blown parathyroidectomy. So with that, they decided that, hey, they're not gonna approve me for surgery. Mind you, I was in my gown, I was at the theater, and my face was super swollen plus super painful, plus I was going through hypercalcemia again, so my calcium levels were super low, and I was having issues with pain to my face, pain to my bones, pain to my muscles. And they sent me back to the ward. I was there, I was getting IV calcium, I was on pain medicine. Mind you, with kidney failure, you can't take any high pain medicine or strong opioids. So I was on like the lowest form of pain. So I was practically bearing most of the pain. However, they were concerned about the hematoma becoming infected, because again, that's clot blood. It has to like go somewhere, it has to come out. The body naturally will heals itself, but when it's too much, it may become a deformity, and plus the infection would have caused several other issues. So 2 days after I was sent back to surgery, mind you, I did the surgery on the Monday, the first surgery, which is the correction, and Monday I had to, on Thursday I had to go back to correct what was done. So I was correcting the correction. Mind you, they had to put me to sleep twice for general anesthesia through a nasal intubation. So they had to push like a tube through my nose, which would go. And the funny thing about it is actually a good thing that the tumor wasn't that big, so it blocked my airway. If it would be very difficult for them to well, actually, I'm saying it the wrong way. They could have put a tube through my mouth, but then they were operating inside my mouth, and the tumor was that big that it could not be operated with a central line. So they had to put it through my nose. The first day on the Monday, that's when they did the first one. It ripped the back of my throat and I was bleeding from the inside. And mind you, the Thursday, they had to go into the same place that they went. So now I went through surgery 2 times in the space of 2 days. However, the sutures that they used was not strong enough, and I think they could not take the pressure of closing the wound, and it bled back inside. So they had switched the sutures now up to a stronger version, which is carbon fiber, and that actually held the wound in place, so it did not bleed back. Also, they had kept on the compression dressing longer, because the first day they had to remove it because of the extra blood, and the compression would have caused the bleeding to continue naturally. But now the compression stayed on. That was super tight. I look like a mommy with the dressing wrapped around. And again, I'll be showing you pictures of everything as much as I can, because some is way too graphic for the internet or for a social platform. So again, as best as possible, I will show you how it looked. The compression dressing, my healing process was very quick, or very fast, I should say. It was like over a week, like little over a week, where I went from not being able to talk, my mouth not being able to be open, I'm in severe pain, to where my teeth started to show. I could open my mouth, I could start brushing my teeth. I now can start eating because again I was on a liquid diet where I had to be fed. Thankfully I had Daniel. And also my mother came as well, and they were the one who really got me through the hard times, helping me to shower, to do everything. Shower, eat, brush my teeth, the entire. Again, I'll show you pictures of all of those. So really the bottom line of really having any type of sickness or procedures, you have to have people, good people in your corner that are rooting for you. So you have like a purpose, you have a reason to live, a reason to want to get better, a reason want to get back to your normal life because there's something to get back to. Financially, I had a lot of help on social media, of course, and also I have been working from I'm 19, so that's really how that works, or that aspect of it. I drove myself to the hospital before surgery. I got out, was discharged, and I drove myself back home. And I stayed home for a while until I healed. So who you see today is completely different from when I was a child, when I was growing up. Also, it was different from when I had the tumor, and it's also different post-surgery. So there is a completely change. I've completely changed several times, but I'm thankful that we're here today and we can actually talk about this, and we can talk about this post-surgery, or post having such a deformed face. Also, I want to really advise like persons with renal failure to try to get your parathyroid testing done early. Try to do your PTH hormone testing early. Try to do the scan to see the growth of the parathyroid glands, and if so, try to have them removed as soon as possible. You can go on artificial calcium, and that will help prevent, because a nurse always once told me that for PTH issues, it can be fixed in the advent it happened, but it cannot be reversed. So whatever changes occurs through the issues with parathyroid hormone being too much or too little, it cannot be reversed. So be proactive in your decisions on how to go about the treatment. If it's that you need to take it out as soon as possible, do that, and so you can have close to normal life with renal failure. Also, just be educated about everything, and so you know how to really maneuver this stormy waters, because it will get stormy. But again, there's always a rainbow at the end of every storm cloud. Again, I want you to keep watching us, stay on the journey. I appreciate you all. We're over 6,000, closing in on 7,000 followers. I want to get to 10,000, so I want you to help us, guys, and we will definitely give you all the inside scoop of what it's like, what a relationship is like. Plus, again, the fun videos, they are coming, the promotions are coming, collaborations, all of that. We're not putting out videos as often as we may like, based on the fact that we want to give you good quality content to watch. So just bear with us. Again, this is Orain from Orain and Daniel. Stay safe, guys.